So October is Breast Cancer Awareness Month, and I decided to make a video on everything you need to know about breast cancer, the symptoms, the signs, what is breast cancer, and how can it be prevented. All this I'm going to be covering in this video, so stay tuned. Welcome back to my YouTube channel. It's your average Nigerian girl, Ada. When I'm not making lifestyle content and all things Nigeria, I make health videos because I am a doctor. So today I'm going to be talking about breast cancer. Why is it even important to talk about breast cancer? This is why. Because breast cancer is the second leading cause of cancer deaths in women, and that is something. This is an illness that if caught early, people actually survive. So why are a lot of women still dying from breast cancer, especially in this part of the world, in Nigeria? Because I am a Nigerian and I'm talking from a Nigerian's point of view. This is because it's not usually discovered early. So that is why we are talking about this thing today. And guess what? Note that breast cancer can also affect men. So it's not just a woman thing, as much as it is women that have breasts, but it can also affect men. So this is not a video for just men, it's a video for men and women. So what is even breast cancer in the first place? Breast cancer is cancer that affects the breast. I'll explain, don't worry, that's not a definition. Okay, what cancer means is that things are growing more than they should. It's like an overgrown bush. Let's say, for example, let's use plants for example. You have a wall, okay, and then your neighbor's plant overgrows into your wall. Maybe it's all these creeping plants and then lines your wall, and you really don't want that kind of thing there. So it's unwanted overgrowth. That's essentially what cancer is, and this is what happens in the breast. And then these cells that are cancer cells, they don't now look like the original cells because they are abnormal. Okay, so they don't look like the original cells, they don't behave like the original cells, they don't die when they are supposed to die, and things like that. So it's like immortality in cells. They are always around and they don't die when they are supposed to die, so they live longer than they should. That means that you have more cells than you should, leading to that abnormal, unwanted overgrowth. Unwanted is very important. Now, what are the symptoms of breast cancer? Number one is, the very common one is a breast lump. If someone has a breast lump, that's not to say that every breast lump is cancer. That's not what I'm saying. But one of the commonest symptoms that you can find is breast lump. Now let's go to the ones that can be subtle. A change in the color of your skin, a change in that's around the breast, a change in the texture of the skin, the way the skin around the breast looks should give you some suspicion. So another sign of or symptom of breast cancer is nipple discharge. When a woman is not breastfeeding, she's not lactating, and then suddenly she's having discharge, that is something that should be checked out. So how do we prevent breast cancer? Because that's the most important part of this whole thing. Because in breast cancer awareness, really, we're talking about how to prevent it and how to catch it early. Because the truth is that if it is caught early, patients can survive. A lot of women that we meet come with advanced breast cancer. That's why you always, when people talk about breast cancer, all they think about is people cutting off their breasts and things like that. The truth is that if a patient comes early, there's actually breast conservative surgeries, but that is why early detection is so important. In fact, we would say that the best way to prevent breast cancer is to catch it early. So how do you go about catching it early? Number one, self-breast examination. This is something that cannot be overemphasized. Every woman should self-examine her breast. I'll put a link of the best self-examination video that I can find in the comments, in the description box. That way it's easy for everybody to assess, because I don't have a model to demonstrate breast examination, and yeah. Yeah, I don't have a model, a breast model to demonstrate, and I didn't want to go through maybe getting an orange or something when there are actually videos that do it so show it so well. So I'll put that in the description box. But also it's important to know that the ideal time to do your self breast examination is 3 to 5 days after your period. Okay, so it's usually after your period, then your breast feels closest to normal. So if there's an abnormality, you'll be able to detect it. As women, we know that when we're going through ovulation, we know some people sense some breast changes. So that is why we usually say 3 to 5 days after your period, your menstruation. Another way of preventing this is that every woman that is above 40 is actually encouraged to do mammography every year. Although here in Nigeria it's a bit expensive, but if you can afford it, please, if you are above 40, get a mammography. It's just yearly, every year. That's something that can also detect lumps and breast cancer cells that your hands might not be able to detect. Okay, so what now happens if you detect something abnormal in your breast? First of all, calm down, take a deep breath. Like I've said before, not all breast lumps are cancerous. Just calm down and go to your doctor. Your doctor will be able to do some further examinations. Your doctor will be able to do some further examinations and order some tests that will help you confirm. And sometimes if someone has a breast lump, usually it is removed and taken to the lab to check if it is cancerous or not. So there is so much that can be done. Now if someone has it's important to know that if someone has a family history of breast lumps or breast cancer, the person should really take this breast self-examination very, very seriously. I'm not saying that every other person should not take it seriously, of course not. But if you have a family history, it it is now very important that you take it even more serious than the other people. Now, abroad, we have genetic testing that can be done for people who have relatives with breast cancer, but it's quite unfortunate that those things are not available in Nigeria. But we make do with what we have, and then we can, as we progress, we can, update on what we can do. So if someone has breast cancer, is it the end of the world? No. There's actually treatments for breast cancer. There's chemotherapy, that is drugs. There's radiation therapy, that's using radiation to kill the cancer cells. So there's so much that can be done, but the take home today is early detection. Don't wait till it's too late before coming to your doctors. Give them options. Early detection, that is why you should do your breast examination every month. So I encourage you to ask women around you today, your friends, because it will be weird if you if you go asking someone, have you done your breast examination? But your friends, ask them today, when last did you do a self breast examination? Together we can, reduce the incidence of breast cancer in our environment. Thank you for watching this video to the end. I hope you enjoyed it and you learned something. Remember to check the description box for the video on self breast examination if you don't know how to do it already. I have other videos linked here, and I will see you in the next one. If you're not subscribed to my channel, please kindly subscribe. Remember to like this video, comment, and share. Thank you so much. Bye.